Here in South Africa, we at the containment stage. As South Africa tries to contain the spread of the novel coronavirus, questions remain on the impact of COVID-19. Should it be contracted by those living with HIV? The country carries a heavy burden of the HIV virus, which is compounded by the problem of TB. Let's discuss this further, and we're joined on the line by Dr. Reginah Osih. She's a senior technical expert on TB and HIV at the Aurum Institute. Doctor, thank you very much indeed for your time. Very good morning to you.
Good morning. Thanks for having me on the show.
Always a pleasure to get you on the show. Always a pleasure to have fresh perspective and experts, because I guess we need to let science lead this charge in order to fight against COVID-19. So what we know in terms of what we hear from the WHO is that those who contract COVID-19, about 80% of those, they actually recover well. Those that need to be worried are the elderly and those that have pre-existing conditions like heart disease. We talk about chronic lung disease, diabetes, etc. Talk to us about what the science says, what the data you have in front of you about those who have HIV and those who have TB. Are they more likely to be severely affected by COVID-19?
Well, unfortunately, we actually don't have a lot of experience right now, given where the epidemic has been raging, has not been really. There's a lot of HIV and TB. So we have very little experience on what the interaction between these two illnesses is going to be. We can tell from our sort of scientific background that, as you know, the HIV virus also attacks the immune system and reduces a certain type of immunity, which is called the CD4 system or the CD4 cells. Now, how that's going to interact with these other viral infections is going to be left up to figuring out once people actually start contracting that have both diseases. But we do suspect that there will be obviously a negative effect of having both of them. And we recommend that everybody who is HIV positive and who knows their status really should get on treatment. As you know, South Africa provides treatment for all in terms of those who test positive, and there's actually same-day initiation available at all the South African clinics. And that we expect that people who do not know their status or have reason to suspect or just want to get a test, now be a good time to go and get a test to make sure that you're putting everything on your side in terms of being on treatment. We do suspect that people who are on treatment and are virally suppressed from an HIV perspective and have a high CD4 count, so have an immune recovery from an HIV perspective, probably are going to be in the same sort of zone in terms of risk as just people of the general population. So hopefully everybody can sort of move towards that goal. On the other hand, TB is a little bit more concerning because TB is a lung disease, and the COVID disease also affects the lungs, and it's a disease that really is very mostly death is caused by lung disease and the inability to oxygenate our blood based on the lungs being affected. And therefore, I would really hope that everybody who has TB is currently taking their medicines, people who are coughing and who have relatives who have TB are going for testing, so that if we get everybody on treatment, we could potentially avert some of these nefarious effects of having both TB and COVID.
Well, talk to us about how we plan to learn more about this in terms of how TB and HIV-infected patients will be adversely affected by COVID-19. We don't have a vaccine. Vaccines, from my understanding, takes a number of years. We were told, latest reports, that we are about a year or so from getting a vaccine, but that's still, up in the air. It's still unclear. What would need to happen in order to, get more research and get more information with regards to how HIV and TB patients will be affected?
Well, so I think currently what's going to happen is going to be mostly what we call observational epidemiology. So we're going to observe what's happening while trying to protect as many people as possible with messaging and ramping up our efforts to put people on treatment. Obviously, we are going to get some people who will get both diseases. And when we get those, we're going to be able to study what happened and what was the likelihood of them getting more severely ill. We can compare the people with HIV and the ones without HIV and see whether there was a difference in the severity of the illness of COVID-19 in these two populations.
Yeah.
I think researchers currently in South Africa are already getting together in terms of some of the structures and processes that need to be in place so that we can quickly get experience about what's happening and start and be one step ahead of this, so that if it really does become a massive epidemic in South Africa, we can adjust our messages based on what we're learning.
Being proactive is very, very important. A lot is known about COVID-19, but there's still so much that scientists are learning about this disease. What do we know about, can COVID-19 change or mutate? What I guess I'm asking is that once a person contracts COVID-19, can they get it again once they are cured or recover, rather, I guess is the better word?
So COVID-19 is caused by a virus that is named scientifically SARS-CoV-2. And what that means is that it's a group of coronaviruses. We have a lot of coronaviruses circulating. These are winter zoonotic cold viruses that would give us the common cold. And every so often we have some of the mutations that happen to create a more significant illness. Which was the case with SARS, was the case with MERS-CoV, which was also a coronavirus. And this new coronavirus that causes COVID-19 is closely related to the SARS coronavirus, but obviously much more infectious and actually more virulent than its previous cousin, if you wish.
Yeah.
So these things circulate and mutate, and they have what we call animal hosts. So they're zoonotic diseases. They go into animals such as birds and different civets and bats, and then come back into humans in a slightly different form that doesn't allow our bodies to have immunity to them. So that's why we become epidemics. So if you're re-exposed to an existing form of coronavirus that you had before, mostly your immune system would be able to react to it and protect you somewhat.
Right.
But the problem with these coronaviruses, and just with the flu as well, is that they have what we call and antigenic drifts, and so they basically change from season to season and come back as almost new viruses.
Yeah. So understand, there's a lot of misinformation out there as well, and a lot of uncertainty. I guess, you could understand people's anxieties because not a lot is known in terms of this disease. In terms of, air travel as well, people are asking you, why don't you do the swabs, the throat swabs at airports and, on the plane before letting people get off the plane? We know that the thermal scan, which tests for fever, is done in various processes, various steps in terms of when you on the plane, when you leave the plane as well. But talk to us about the throat swabs, because the understanding is that it tests for the viral RNA, and the viral RNA can only be or discovered with this test if the person is symptomatic. So a asymptomatic person, a person that doesn't show symptoms, you can't really test for COVID-19, correct?
Yes, generally you want the person to be shedding virus, and we know recently that the people who have been sort of asymptomatic carriers are not really asymptomatic. They're just very early on in their symptoms. And then you test their nasal secretions and to see whether they have that. First of all, these tests, we don't have a very rapid test for this, so it has a certain turnaround time. So from a practical perspective, it's going to be really difficult to do these tests in situations where we need immediate results.
Yeah.
The other thing is that currently people are focusing more on the sick people and not necessarily on the healthy worried. And I think that that's something that we should keep in mind.
Yeah.
In South Africa, we're lucky that we have the NICD that has thought about this for a very long time and has processes and systems in place. And I think what people should do, and especially news agencies just like yours, is to really make sure that we are have access to the NICD messages and that we follow the rules that they have set out, because there are experts sitting out in war rooms talking about this from morning to evening and figuring out what is the best way. Sure, there are sometimes missteps. As you can see, different countries have had different approaches, and we're all learning as we go. But really, I think people should take this very, very seriously, but shouldn't panic. And I think there's a very fine line between those two things. And it's a line that's actually very difficult to walk for most people.
Accurate information is key in order to bring down, I guess, the panic levels. Talk to us about, if somebody has so-called flu-like symptoms. We're entering winter, flu-like season, flu season, so to speak. If somebody has a sore throat or is coughing, general fever, general malaise as well, and it's freaking out and don't know what to do. Should I go to the hospital? Should I test? What's your advice to somebody who's sitting at home thinking, do I have COVID-19?
Well, so currently, if you look at what the NICD recommends, is that we're still at a stage where we've only had sort of transmission from local cases. We don't have what we call community transmission. So currently, everybody who has the disease has been exposed to it through a contact that we are aware of. However, if it starts being a community transmissible disease, meaning that, you could get it anywhere in a supermarket, taxi rank, or in a pharmacy, we want to make sure that we don't send people who have COVID-19 the house where you can find other vulnerable people with hypertension, diabetes, cardiovascular disease, HIV or TB. And so we'll have to reorganize how we do this. But currently the recommendation is to say, if you're having mild symptoms, stay home. Try not to practice your social distancing, try to perhaps not to go to work, don't expose other people to your illnesses. If it's the flu, will pass. If you end up being more severely ill, having difficulty breathing, at this point you should present to one of the hospitals that have been identified by the NICD as the sort of centers for COVID to get a test. You can also present to another hospital in the private sector to get a test from one of the private labs.
Right.
But we're trying to minimize millions of people showing up with the first sniffle. And especially if we have community transmission, the social distancing is going to become really, really important. Yeah. And, having people congregate in hospitals is probably not the best way. Yeah. We know that in China and in South Korea and others, they instituted some drive-through testing. Obviously those decisions will be made when we get closer to them. Yeah. And then also they've instituted what they called fever clinics. So everybody with cough and fever went to the same place and they isolated those from all the other people who didn't have cough and fever and provided testing in those situations. So those are things that I am sure our government is thinking about and will have updates as the epidemic progresses.
Let's talk, Doc, about practical considerations and in particular how COVID-19 interacts with water. Parents have often asked, can I send my child or can we even go to public pools? What's your advice?
That's a difficult one. I think that we haven't really had a lot of experience because this is a cold season virus and everywhere where there's been an infection, it's been really cold. You can see north of Italy is winter. China was winter as well, so people were not really exposed to swimming. Yeah. I do think that there's an element of dilution once you get into the water, but the pool is like any other social distancing measure. Just avoid going somewhere where people might be sick, where you may meet a lot of people who have symptoms. And so I think that right now, people can, since we still are not in the community transmission phase, I think people can go about their lives as normal, which is what the NICD has recommended. Yeah. And then as we're surveilling this epidemic, once we get to the next step, we're going to have instructions about all of these activities.
Lots of questions. We appreciate your fresh perspective. Doc, thank you very much indeed. We'll probably have you back here again because there's so many questions that folks have and we need experts like you to answer them. Thank you very much indeed for your time.
Thank you.
All right, that was you too, Dr. Reginah Osih, a senior technical expert on TB and HIV and also very clued up on COVID-19 from the Aurum Institute.